fork is used to compare hearing by bone conduction and air conduction. Hold the stem of the tuning fork without touching the tines and stroke or tap the tines gently to make them vibrate. The Weber test helps assess unilateral hearing loss. Base of the vibrating tuning fork on the midline of the patient's head.
I want you to tell me whether you feel the sound louder on your right ear, left ear, or equally.
The patient should hear the sound equally in both ears. If the sound is lateralized, have the patient identify which ear hears the sound better. The Wright test helps distinguish whether the patient hears better by air or bone conduction. Place the base of the vibrating tuning fork against the patient's mastoid bone and ask the patient to tell you when the sound is no longer heard.
I want you to raise one finger when the sound stops. Then I will put it in front of your ear and I want you to raise your finger when the sound stops again. Okay?
Air-conducted sounds should be twice as long as bone conduction sound.
Percussion reflex hammer. The percussion hammer is used to test deep tendon reflexes. Hold the hammer loosely between the thumb and the index finger so that the hammer moves in a controlled direction. As you tap the tendon, use a rapid downward snap of the wrist. Tap quickly and firmly, and then snap your wrist back so that the hammer does not linger on the tendon.
Use of the pen light is to assess PERLA, which is pupils equal, round, react to light and accommodation.
I'm gonna dim the lights.
With your patient looking in the distance, use your pen line to shine light onto each pupil. The pupils should constrict in response to light. Note both the direct response, that of the same eye, and the consensual response, that of the opposite eye. They should dilate with far gaze and constrict with near gaze. A patient whose pupils are equal, round, and reactive to light and accommodation has intact cranial nerves 2 and 3. Document PERLA for this patient.
PPE, personal protective equipment. First start off with the gown. Fully cover the torso from neck to knees, arms to end of wrist, and wrap around the back. Fasten in back of neck and waist.
So we tie the neck first, and then we go ahead and we tie the back.
Mask, respirator.
5 masks, this is the way you put it on. You grab it, you put it on. First, over here, and second.
Next goes the goggles or face shield.
Face shield.
Place over face and eyes and adjust to fit. Next steps are the gloves. Extend to cover wrist of isolation gown. Sequence for removing personal protective equipment. First, we start off with the gloves. Outside gloves are contaminated. Grasp outside of the gloves to opposite gloved hand, peel off. Hold and remove glove in glove hand. Peel glove off, over fist glove, discard glove. Next step, goggles or face shield off the face. Outside of goggles or face shield is contaminated. Gown, start off at the neck. Unfasten ties. Inside out, fold and roll into a bundle and discard. Mask or respirator. Front of mask is contaminated. Do not touch. Grasp bottom lap first. And then the top. Discard in waste contaminator.
Now in chart, patient must sit exactly 20 feet from the chart. Glasses or contact lenses, leave them on. Ask the person to close one eye at a time during the test. Ask the person to read through the chart to the smallest line of letters possible.
PEZOLCFTD. Otoscope. First inspect ear for any drainage or tenderness. Choose largest speculum that will fit comfortable. Tilt patient's head slightly away from you. It brings the eardrum into a better view. Pull the pinna back, up and back on an adult or older child. This helps straighten the S shape of the canal. Pull the pinna down and back if the child is under 3 years old. Make sure you use right hand for right ear and left hand left ear. Place dorsum of your hands along with patient's cheek to avoid injury. View all aspects of the tympanic membrane. Inspect for color. It should be pearly gray.
Pulse oximeter is used to measure patient's oxygen level in the blood and heart rate. Operates by shining light through the skin to the blood vessels below. Turn on the pulse oximeter. You're going to place the sensor on any finger with screen above the nail. Wait for the results. Do not use the thumb. An oxygen level greater than 95 is considered to be normal. Less than 92 is suggested to be a low blood oxygen level. An ophthalmoscope is a handheld device used to examine the eye interior structure, including the retina. Today we are going to use it as a part of the assessment to perform the examination of pupil reflection, also known as the red reflex. To start, dim the lights of the room and hold the ophthalmoscope close to your eye. Encourage the patient to look at a distant object behind your shoulder and direct the light at the patient's eyes individually and simultaneously.
I want you to focus on the picture behind my shoulder.
You should see an equal and bright red reflex from each pupil. Thermometer. Make sure to remove patient's shirt or undershirt and place a thermometer under the axillary, known as the armpit, touching the skin, not the clothes. Fold the arm across the chest and hold the thermometer in place. Wait until you hear the appropriate beep or other signal, and then read the temperature. Measured in the axillary position under the arm, the temperature should be 99 degrees Fahrenheit or 37.2 degrees Celsius. Remove it.
Make sure to clean the stethoscope. The acoustic stethoscope is a closed cylinder that transmits sound waves from their source and along its columns to the ear. Its rigid diaphragm has a natural frequency of around 300 Hz. It screens out low-pitch sound and best transmits high-pitch sound, such as the second heart sound. The bell end piece has a natural frequency that varies with the amount of pressure exerted. It transmits low-pitch sounds when very light pressure is used. The chest piece contains a closure valve so that only one end piece, either the diaphragm or bell, is operational at any one time. Angle binaurals points the airpiece towards the nose so that the sound is projected toward the tympanic membrane. To stabilize the stethoscope, when it is in place, hold the end piece between the fingers, pressing the diaphragm firmly against the skin. Place the bell evenly and lightly on the skin, making sure there is skin contact around the entire edge. We use the diaphragm to auscultate vascular sounds. Use the bell to auscultate sounds like bruits.
Rhodes lamp examination is a procedure that uses a ultraviolet light to detect bacterial or fungal skin infections, also for skin pigmentation disorders. Light is used in a dark room. If you have an infected area, your skin would be a different color.
I'm in love with the shape of you. We push and pull like a magnet do. Although my heart is falling too. I'm in love with your body. Last night you were in my room, and now my bedsheets smell like you. Every day discovering something brand new. I'm in love with your body.